But today, let's look at another dimension of healthcare, a less talked about dimension of healthcare being an employer. We present to you our next speaker, the founder of Narayana Hrudalaya, Padma Shri, Dr. Devi Prasad Shetty.
Dear friends, I'm sorry I could be there physically to address you, and this is the best we can do. I would like to give you some idea about the manpower requirement for healthcare industry. Global healthcare industry and wellness industry is a $4.5 trillion industry. It is much bigger than automobile or a software industry. You are aware that agriculture industry is the largest industry on this planet, followed by healthcare industry. So you are talking about a huge industry. Now let's talk about the employment generation. Largest employer on this world is the Chinese army. Second largest employer of this world is the Indian Railways. Third largest employer is the National Health Service of United Kingdom. Just looking after the healthcare of over 50 million people, they have hired the third largest workforce. You imagine a situation where the healthcare industry of our country blossoms. It can emerge as the largest employer, much bigger than the Indian Railways. If you go through the data from Bureau of Labor Statistics from USA around 4 years ago, out of the 20 fastest growing occupations in US, 16 are in the area of healthcare. That shows that as the world is growing older, you need millions and millions of people in the area of healthcare. Unfortunately, in our country, employment generation in healthcare industry is looked up as creating more doctors and nurses. But in terms of percentage, they form a small percentage of the healthcare specialist. You need large number of medical technicians, paramedicals and other people who make the life of the doctors very comfortable. Unfortunately, there is very less effort in the part of the policymakers to address this great requirement. I hope policymakers look at the healthcare industry as an industry which can create millions and millions of jobs. There is a major shift happening today in the way the healthcare is delivered in India. We believe that India will become the first country in the world to dissociate healthcare from affluence. India will dissociate healthcare from your bank balance. In our lifetime, you will notice that millions and millions of people of our country will live in the slums with no running water, no toilet. But when they are unwell, they will have access to high-tech healthcare with dignity, like an American or a European citizen. There will be a gross disconnect between where these patients come from and the quality of healthcare they will receive. This will happen because government will become a health insurance provider than a healthcare provider. When government starts running health insurance like the way we started with Karnataka, in Karnataka state with the state government, Yeshasvini micro health insurance, wherein farmers were asked to pay 5 rupees and for every 5 rupees the farmer paid, state government paid 2.5 rupees. This is how we launched a very successful, first of its kind micro health insurance program 5 years ago. Now this has become a very major program covering the lives of millions of people. 2 years ago, Andhra government launched a very ambitious program called Arogya Shri, in which nearly 80% of the state population is covered for any type of operation. There are other 18 governments studying this model of Yeshasvini and Arogyashri, trying to launch their own version of micro health insurance program. Because today politicians have to deliver. People demand some services. I want to end by saying that politicians all over the world do the right things for the wrong reason. Giving the health insurance is the right thing they have to do, but they are doing it for some other reason. But it doesn't matter why they are doing it, as long as we get health insurance for everyone. All the best. God bless. Thank you.